our surgical technology lab. My name is Amanda Barney, and I'm the Health Sciences Program Coordinator.
I'm Ashley Sumner. I'm a certified surgical technologist, and I am the program director.
My name is Michael Lane. I'm the surgical technology and sterile processing instructor.
My job as the Health Sciences Program Coordinator is to work with the students to become eligible to apply for our surgical technologist program. Our program director, Ms. Sumner, is going to talk about the program itself, a little bit of information about how we go through the program, what to expect, and then we'll talk about labs and clinics afterwards.
Our program currently consists of 4 semesters. At the end of this program, you will be able to sit for a national certification, which will certify you as a surgical technologist. We'll go through several semesters of learning surgical procedures, in-depth anatomy and physiology, and what it takes to be a surgical technologist. You'll learn how to scrub in to surgical procedures, set up your tables to prepare for procedures, and also you will learn how to sterilize instrumentation.
The day-to-day expectations for the Surg Tech program, once you're in this program, it's pretty much a 4-day-a-week program, Monday through Thursday. Lecture, which is basically classroom time. Labs, where you learn to apply those skills that you learned in lecture. And then we have the clinical setting, where you actually go to an operating room and practice those things that you learned in lab. Typically, the clinical sites we have vary in locations. We have about 7 different locations, and we try to rotate students into the different locations so they get different experiences at different places. A surg tech can work in an actual operating room at a hospital, or you can actually work at a surgery center in an outpatient environment. Clinic days are usually 2 days a week, and they usually consist of 6:45 to 3:15 in the afternoon. The other days of the week, you'll be doing lab days, where you'll come into here in this environment and practice your lab skills, and you'll have classroom time to do lecture.
Now that you've heard about our labs and clinic sites, here's some information about why you should become a surgical technologist.
So first of all, a surgical technologist is one of the most integral persons in the operating room. We are part of the surgical team, and we ensure patient safety by maintaining sterility throughout the entire surgical procedure. Generally, as a surgical technologist, you're certified, and you can work in different types of settings, usually a hospital or a surgery center, or sometimes you can even work privately for a surgeon. The salary, because of this reason, will vary based on your experience. So you're probably wondering why somebody would want to become a surgical technologist. The number one reason, for me especially, was to take care of patients. I've always enjoyed watching the operating room videos on TV, and so it made me more curious about the operating room atmosphere. Most people like to be part of a team and feel like a family and feel like we're contributing to patients every day. So it's very rewarding. Not to mention it's really cool to be in surgeries.
We encourage you to look at our website and reach out for any questions based on eligibility and being able to apply to our programs. And thank you again for watching our video on surgical technology and being interested in our program.
Daphne's our surgical technology student. She just finished scrubbing in. She's going to put on a sterile gown and sterile gloves and finish preparing her operating room table for the surgery. When putting on a sterile gown, it's important to stay 12 to 18 inches away from the sterile field to keep everything from being contaminated. This is what we call the closed gloving method. Her hands are inside the gown the entire time until the glove goes over the cup. Abby's our circulator. She helps facilitate the procedure in the room. Daphne's going to tie the back of her gown by passing the card. once she's done tying, she's gonna go over to her operating room back table and get ready to count her instruments and her supplies with the circulator.
Okay, I'm ready to do a count.
Okay.
Ray text 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Laps 1, 2, 3, 4, 5. Blades 1, hypo 1, scratch pad 1, bobby tip 1.
Okay. Instruments.
Instruments. You have mosquitoes 1, 2, 3, 4. Kellys 1, 2, 3, 4. Cokers 1, 2, 3, 4. Right angles 1, 2. Alice 1, 2, 3, 4. Babcock 1, 2. Cokers 1, 2, 3, 4. Needle drivers 1, 2, 3. Scissors 1, 2, 3. Sponge sticks 1, 2, 3. Perforating towel clips 1, 2, 3, 4. Non-perforating towel clips 1, 2, 3, 4. Pickups 1, 2, 3, 4, 5. Knife handles 1, 2. Richardson retractors 1, 2. Army Navy 1, 2. Gelpy 1. Wheatlander 1. Sunrigs 1, 2. Double skin hook 1. Single skin hook 1. Brazier section 2 pieces 1, 2.
Count's correct.
Mr. Lane is our surgeon today. Daphne's
Good
assisting
morning.
him by giving him a towel to dry his hands. And then she will put a sterile gown over his arm. Abby will tie him up in the back. And Daphne's getting his gloves. They're going to begin by draping the patient with a couple of towels and some towel clips. Today they're simulating the draping for a left inguinal hernia repair. The clips are used to hold the towels in place, so when the large drape is applied, the towels do not slip down and cause any contamination of the surgical site. The next drape is a medium sheet which gets put down on the bottom half of the bed, followed by a laparotomy drape. And this drape will cover the patient's entire body. This has to be done very carefully so not to contaminate the hands of the surgeon or the surgical technologist. And the surgeon is placing the drape over the abdomen. The surgeon and surgical technologists are very careful to make sure that their hands are protected. Anesthesia is securing the drape to the IV pole. And now Daphne has the cords that are used in surgery.
Help with it.
There's a Bovie cautery and suction. And Daphne will place the light handle covers on so that way the light handles and lights can be adjusted throughout the surgery. Once all the cords are situated, Daphne will bring up what's called her Mayo stand, which has all of her starting instrumentation. And then it will follow with her back table. And the surgical team will participate and a timeout. A timeout is a moment to pause before beginning a procedure to make sure that we have the right patient, the right procedure, and any known allergies.
Time out.
This is John Smith, date of birth 1/22/78. He's here for a left inguinal hernia repair, no non-allergies and antibiotics.
2 grams of Ansef.
All right, we all
Everybody
agree?
We agree.
All right, 15 blade.
I'm looking forward to being a scrub tech for real and having that freedom to kind of take my own spin on things, because everybody does it a little bit differently in the OR. Everyone has their own little tips and tricks and like ways that they like to do it. So I'm excited to finally have that freedom to do it on my own.
I could definitely say it could be your time management depending on if you have family or work, which lucky for me, I don't work, but it's important to put in your time into studying and make sure you do your research, because when you're in this program, you're gonna have the experience that you'll need, but you can't just go off on experience alone. You need to make sure you reread your textbooks, you look over your notes, you study, because the best thing you do in this program is repetition and to make sure you have the common knowledge that you need to go out there into the ORs.
To get your prereqs out the way before you get in the program, and keep your anatomy books, because anatomy is a big thing in this program.